Hi, everybody. Can you hear me? Ah, it's on. Great. Well, hello. What a wonderful big group this is. And I just want to make sure I can see that clock. Great. So I'm going to talk about direct primary care as an engine for innovation. So first I want to just ask people to kind of imagine in their mind, when you think about innovation these days, what you imagine. So you might think about like a scientific lab and scientists in lab coats and their lab assistants with beakers and bubbling things and doing experiments and trying to solve for scientific problems and excited about it, trying to solve the latest thing, or software engineers clack at their computers and up at whiteboards, excitedly trying to solve for algorithms and all those things. You can tell I'm not a software engineer, I don't know what I'm talking about. Or an engineer or a group of engineers trying to improve on a machine to make it more, to do a robot to do something incredible, or even sort of a garage mechanic trying to improve on a tool so it could do something better. All very exciting, fired up people trying to fix something, trying to make it work better. Very interesting and exciting, right? Now I want you to picture innovation in healthcare delivery. Woohoo! Blanks in your minds? Yeah, exactly. So when we think about innovation in healthcare delivery, it's not that exciting, right? You don't usually picture really interesting, exciting stuff going on and people excited about it and doctors in their lab coats thinking about exciting new ways to help their patients get better, right? And employers and the benefits advisors who are here thinking about going out and advising your clients on what kind of healthcare they should buy. It's not like you can talk about a lot of healthcare out there that looks like that, right? So the cool thing, though, is that all of us in the room who do direct primary care, we have a little secret, which is that we do that every day, right? We go to work and we're really excited because we get to be the tinkerers in the garage or the scientists in the laboratory or the engineers tinkering and experimenting, trying to figure out the best possible way to get our patients better. And every day when we go into work or we sit down with our patients or we go home at night, we're looking things up and we're thinking and we're studying and we're working, or we're sitting there with them, researching, trying to figure stuff out to get them better. Or we're experimenting with our businesses, trying to figure out how to make them run more smoothly, or working with our staff, trying to figure out how to make things run more smoothly, or how to make them more efficient, or how to work together better. Or we're entrepreneurs with a bigger business, with multiple clinics, trying to figure out how to make everything run better, or how to do more, or how to do it better, or how to offer a better service to our clients. That's DPC, and that's what's so exciting about it. And that's what DPC has to offer the public. When you think about the fee-for-service primary care system, what's wrong with it is it's based on a productivity model. And productivity, I remember back when I first, actually in residency and even in medical school, I remember thinking, wait a second, I'm a lover of language. And I remember thinking, what kind of language is this that we use to describe what we do? We talk about productivity and relative value units. It's production line talk, right? And all of us who are physicians and nurse practitioners and all these folks who get measured in this way, I know we think about that and we think, I feel like I'm an assembly line worker, right? Because that's what we are. And what do you get out of an assembly line worker? Productivity, right? You're not looking for creativity. You're not looking for invention. You're looking for chop, chop, faster, 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 faster. You want accuracy, but that's about it, right? And if they don't do things accurately and quickly, out. You want to plug somebody else in. That's about all the system wants. So when you buy that kind of care, that's about all you're buying, is fast and hopefully accurate, although we know that a lot of healthcare is not all that accurate either, but it's maybe fast. And frankly, it's not very efficient and it's not very cheap. It actually just keeps getting more and more expensive. And that's the other problem with the system is that, as employers, oh, it's not working? Okay. I guess I'm moving around too much. Employers or companies typically have people competing to sell them services and goods, and competing on the basis of things have to be better and faster and cheaper all the time, right? Healthcare is different. Employers are having to buy usually worse and more expensive healthcare always for their employees. So here's this one area of stuff that the employer has to buy that's frankly not getting better or cheaper, it's always getting worse and more expensive. So what does DPC offer? Not only better and ultimately less expensive, but now we can say it's more innovative. How cool is that? So just like other vendors show up at companies and say, hey, not only do I have something that's less expensive and is going to make you more productive and save you money, it's also more innovative. You can be more cutting edge. I want to share with you very briefly a story. So a little background on me. I, along with Garrison, started Q-Liance years ago, and we ended up growing to about ultimately 6 or 7 clinics, and we served employers and Medicaid and all that kind of stuff. And the vision I always had for that was that we should be a laboratory of innovation, and that every clinic should be a laboratory where we would invent new and better ways of doing things, and that every one of our staff members, not just the doctors, would be always looking for better ways to do things and to serve our patients. And one year, a reporter for Time magazine came and wanted to report on us, and they did an article on us. I think it was in end of 2014 it was. And he wanted to talk with medical students because he thought, I wonder if this is going to be more attractive to students. So we went over to University of Washington, and I just was sitting there half listening to the interview, answering some emails on my phone. And all of a sudden, I heard one of the students say, the question was something like, is this the kind of medicine you would want to do? And he said, well, yeah, this is cutting edge medicine. And I stopped and I looked up and I said, wait, what did you say? And he said, yeah, this is cutting edge medicine. So this is what you all need to see this as. This is cutting edge medicine, because when you put the doctor back in the position of scientist and see primary care as being a legitimate science within healthcare, and set up a business model that allows that creativity and science to come forth, you actually really do create something cutting edge. What's also interesting about this opportunity, and I think, you know, if you poll this group, the folks in here who do direct primary care, I think this is a great opportunity, you know, for all of us to take advantage of, is that I bet you would find thousands upon thousands of small and large innovations that this group has come up with about how to care for patients better. I mean, I know when we all get together, we talk about all kinds of anecdotes and stories about things we've done for our patients that worked great, that changed people's lives. You hear stories abound all the time. It's very exciting. And I know I always come away with another idea for another patient. Harnessing that is a really great opportunity. And here's the thing, employers actually have a great opportunity to harness that in a way that will benefit them and benefit society. So an employer who purchases direct primary care on behalf of their employees can serve as an aggregator of not only that care, but all the data that they can then, once they've pulled it in, send it back out and help teach the practices what they're doing. So not just from the sense of saying, hey, here's how you're doing from a cost and outcomes perspective. Here's what's happening with this population. What do you think? What are you learning from this? What can you tell from this that you can do more with? What can you tell us about our population? What can you tell us about our workplace and what's happening with our workers? What can we do differently as employers that might help create a healthier, longer lasting, more productive workforce? There's an incredible opportunity for synergy here. We started to do this a little bit with some of our employer clients. One of them was a fishing company that we worked with. And we even went so far as to go and visit their ships and walk around all their ships and say, oh, now we understand what their work situation is like and what's possible and what's not possible in terms of adjusting their work situation. So we were better able to be partners with them, and we changed the way that we were practicing, the way we were advising the patients. We also made recommendations to them about how to change the food they provided on the ship. And Some of the changes were possible now, some of them were things they were going to ease into over time, et cetera, et cetera. And then we watched the data over time. Another example is firefighters. We learned a lot about the way that firefighters were exposed to illness and injury, and it wasn't exactly what we expected. And so we were able to make recommendations back to them about ways to manage and prevent injury, and then handle work injuries differently, and when to bring people back to work and how to rehabilitate them, et cetera, et cetera. So those are just a couple of examples. So tremendous opportunities here. Benefits advisors, I know I'm mainly speaking to the folks in the group who are benefits advisors who represent employers, but this is a really important message for you to think about delivering to the employers when you're thinking about the value proposition of direct primary care. It's not only are you telling them all the other things that you're going to be telling them about direct primary care, but you're really telling them, look, you can grab a hold of healthcare, but not only healthcare and what happens in the whole healthcare system, but also the feedback loop to what happens within your company and with the folks and how they work in your company and how they live in their everyday lives and how that feeds back to your bottom line. Because it's not just about the healthcare they receive in the healthcare system. It's about the education and the care and the feedback loop that's going to happen with a direct primary care practice, because our business model allows us to adapt and invent based on the population that we serve. Rather than taking a cookie cutter approach that forces your employees to adapt to us. That's what the fee-for-service system says. It says, I'm a factory assembly line. Everyone is a widget. They all have to come through in the same way. They all have to have a 15-minute appointment. They all get to talk about 2 problems max, and then they have to make another appointment and come back. And if they have to miss more work to do that, too bad. And you're going to pay the same amount for every single person. We don't do that. We say, bring them in once, cover everything, follow up by phone, follow up by video. Maybe we have extended hours. Hey, maybe we even work with you and talk about the kind of hours that your employees work and adjust our hours around you. I don't know. That's the kind of practices we have. So these are just some examples, and I just want you to think about the many more potential things you can do with this. We just got started at Q Alliance, and I know there are some practices here, small and large, that have been and are doing some incredibly innovative stuff, and maybe some of you are already partnering with them. But really, the sky is the limit, and that's what primary care is meant to do. It's meant to serve, it's meant to adapt to, figure out, and help the communities that it serves. It is a quintessentially adaptable, innovative, and forward-thinking animal. It's an organism, right? It's a function of the system. It's supposed to adapt with its community. You can really harness that with the DPC model and with all the folks in this room and the many, many more out there who are doing this. And you, as employers, I'm saying you through the benefits advisors, you can actually serve as an engine for innovation for our entire healthcare system and push our whole system to change. Because employers are such a huge purchasing block in this country that God knows we've tried to change the system and have been so unsuccessful that unfortunately it may end up falling to employers to bear the brunt of this work. And I hope that employers will see DPC as their friend in pushing innovation. We are ready to serve, and we are anxious to serve, and we love to innovate. We are like mad scientists ready to go, and we love it. We love to learn new stuff. We love to help people. We want to get them well. That's what we went into primary care to do. And given a chance, we will go hog wild on this one. Finally, I'll say, and this is more of a public policy thing, less an issue for employers, but I'm saying this more for the DPC folks in the crowd. Imagine ultimately if we could link ourselves all together, the mass of knowledge and information that we could harness. Imagine if we could aggregate all of our data and knowledge and information, the phenomenal primary care research we could do. It gives me chills just kind of thinking about it. Imagine the power of that knowledge and learning and science if we pulled it together and put it to good use. Thank you.